Happy Friday, everybody. Happy Friday. What a week it has been. And you know what I'm talking about. Um, but business goes on as usual because there's a lot going on and we got a lot of work to get done. So, Jordan Wrigley, who helps lead our health work and is helping lead our new work in this elder aging AgeTech. Got to come up with the right terminology. I've been saying AgeTech, and then people think it's all about age gating youth and age assurance and so forth. I think you get what we're talking about. Here's what we're talking about. We're talking about the fact that 1 in 5 in the US, 1 in 5 by the year 2040 will be over 65. So what about that? That means we are going to have a huge senior population compared to the current because of the retirees from the baby booming generation. The working generation entering the workforce is much smaller. That means fewer people paying income tax, fewer people paying into Social Security, fewer younger people coming out of nursing and medical school and so forth, going into caregiving. A huge mismatch. And what does this mean for the economy? And this isn't unique just to the US. There are countries where they're deeper down the line already on this. Japan is one good example. You read about these stories in Japan where, entire villages are just becoming, desolate. People who've run a successful business, but there's no one to, we literally take over the family business and, they're abandoning it or trying to, pay young people to kind of come there and step in. There may be interesting lessons to learn from Japan, but a good range of areas around the world. And then, of course, there are other areas around the world where the population is very, very young, and it's creating a challenge today in terms of having what's needed in terms of education and so forth. So the U.S. is rapidly heading in this direction. Some of the changes related to immigration maybe will exacerbate that. We'll see whether policymakers somehow figure out, after getting through the political battles and challenges and so forth, how to actually, ensure that we have a workforce in the U.S. available to provide the services and jobs that are needed, and also earn the income to contribute. And technology is not going to solve it. We need the humans, we need the funds, we need the healthcare system and all of its problems and challenges. We need scientific research. Technology is not going to solve the problem. But technology already plays some role. We saw seniors during COVID being able to interact with family members remotely for the first time, people who maybe never managed to sort of use, many of us, right? Some of us have been using video conferencing for a long time, but lots of people never really did. And all of a sudden, we fumbled our way through. And the lawyer was upside down in the courtroom. And, some elder members of my family, when they Zoom on their phones, their noses in the picture and nothing else. But we got there. And with the incredible developments in AI, whether you're of the view that AGI will be here tomorrow or never or in between, whether agentic AI is going to provide some solutions, who knows? But clearly tech and AI are going to play a much bigger role. And I think it's time for us all to start looking at that, because do we have the policies in place to deal with this avalanche? We've spent a lot of years working in the school system. It was clear 10 years ago when EdTech was the solution, and it was going to revolutionize learning, and it was going to provide personalized learning and give teachers lots of tools. And we saw an incredible backlash. Parents worried about, are tech companies going to use my kids' data? Teachers worried about were their jobs going to be eliminated? Others, debating every aspect of surveillance and autonomy. And schools have been working through it, but it was a painful process. And we passed new student privacy laws in almost every state. Are we situated properly with the limitations of HIPAA, with the limitations of not having a national privacy law, with um, the complicated world we have where technology can be commercial and ad supported, um, lots of issues. So Jordan and I are going to get into it, and we welcome thoughts. I will tell you, no announcement today, but we will soon have an interesting announcement about a big project in this area, and some foundation funding, and we're sort of putting together the final pieces around that, and we will announce what I think is a very exciting project, but not today. So, Jordan, in my big picture framing, before we maybe jump into some of the specific companies and the access to data they don't have that they want. Thoughts on sort of the big picture framing of the problem?
Big picture framing is a really great question, Jules, because it seems like there are not only the big picture, but a lot of small pieces and parts and moving cogs and bells and whistles to go with this problem. So, overall, as you mentioned before, we're having a rapidly aging population and sort of lack in the US the workforce or social programs to support aging in a dignified way that supports autonomy until they need greater care. And at the foundation of that issue is this understanding of our field of privacy is what role does privacy play in things like autonomy? What role does privacy play and consent play in relationships between elders and their caregivers? Overall, we're also seeing things like I was recently just looking up a couple of studies this morning showing that more and more caregivers are working from distance to care for their parents. We're seeing long distance caregiving. And as you mentioned before, things like Zoom, things like Skype can play a big role in maintaining the contact between a caregiver and an elder who is a little bit farther out. Likewise, unfortunately, one of the saddest statistics I found was that productivity is suffering as a result of our inability to care for our elders, informal caregivers, so usually adult children caring from their parents. Out of an 8.8 million sample, 23.3%, around 2 million informal caregivers suffered a deep decrease in productivity at work due to absenteeism or presenteeism. So we're seeing those economic costs of not having sufficient space and play. Yet we have very minimal in research, which, as you mentioned, we hope to do in the near future to support the policy and guardrails we need to create tech that is both simultaneous what our elders want and our seniors deserve, while also supporting caregivers in the same way and enhancing the trust in those relationships, as well as supporting the growth and innovation in those technologies.
Yeah, and I think quite thoughtful. I think when you helped to work on our sort of proposal here to frame this as, not just about the seniors, it's really about the seniors and their caregivers, whether it's family or professional or the like, and the surveillance and monitoring issues are relevant there, as well. It wasn't
Mm-hmm.
that long ago that elderly family member, who passed away, but was suffering some of the challenges of aging, and the on-site professional care that she had. She was constantly, having issues and paranoid that they're stealing from her or doing this or doing that, and the family was like, well, we have to put like some kind of monitoring thing on there, and then well, wait a second, is that okay? Do you need to the whole kind of nanny cam type issue, and if we tell the our elderly relative about it, she'll say something about it, like, but then she keeps firing every attendant, saying that they were doing something bad, like, and we're not there. It's so complicated in terms of the family dynamic as well. So I shared in a post earlier, and we can reattach it here, one of these investor maps, how they see the field and where the money is going, and the money is going. There are huge investors, Silicon Valley type folks, just placing their bets all across the landscape, and the Silicon Valley sort of funding drive in many ways is both a blessing and a curse for startups. The blessing is they're is access to capital. And we see some of the challenges around the world. Europe, which has great scientists and great startup people, but there's a huge challenge in getting access to capital. And in the U.S., it's almost the alternative. The VCs say, "You want that much? That's ridiculous. We want you to have 10 times that much because we want you to grow fast and be the first and lock up all the deals and go, go, go. And we're actually going to bet on 3 of your competitors as well. So take money and run." Now, that leads to huge successes and tons of failures.
Mm-hmm.
And it's been one of the ways with a survival of the fittest, economic battle that the US has been enormously successful at spawning, companies that have become so significant. But the downside is that those early growth companies, many who sometimes are even exempted from, hey, they're small startups, they should be exempt from, certain levels of regulation, are rushing to data and rushing to access data. And, compliance is expensive and privacy officers are expensive and AI governance is expensive. And if you're doing more than your competitor to be careful and conservative, well, that should stand you in good stead in terms of, hey, I should be trusted. I should be the right one to have access to the data. But frankly, sometimes that falls by the wayside and the winner is the most aggressive. And so do we have the guardrails that set a clear line so that those companies who all think they're doing wonderful things, they're saving the world, they're providing, health, they're helping seniors, also recognize that there are countervailing concerns. Surveillance, our friend Tara Tauman in Europe flags privacy issues for seniors, life assistants that access their documents don't get privacy training, IoT devices, no privacy, no dignity, internet connected hearing aids. So absolutely, these are the issues that I think we want to put on the table so that we understand what kind of guidance these companies should have so that the good is what we get and that we at least try to minimize the risks. Okay, so I'm looking at health categories. So you've got all these apps. They're going to help you, manage your pills and not be confused about which one to take and better connect with doctors, telemedicine, right? Wearables that might indicate that you have fallen. That's not new, but now with more sophisticated smartwatches, is your heartbeat being interrupted at night? Is your O2 level down? All these sorts of things. Fall prevention and detection, senior living environments that can be more supportive, retirement type tools, right? Investment planning, maybe making sure you're not being scammed by phone calls or other schemes, assistive techs in general. Another relative of mine is lost most of their hearing, and they need sort of the glasses that will transcribe live. And you can do this with your phone today. And I was showing him how to do it, but you can't look down at your phone when you're at a conversation. This weekend is Passover. Our extended family will be having a Seder, and the older adults, there's going to be a cacophony of people. It's wonderful. Everyone's around the table, extended family, but I cannot hardly hear because everyone's like, talking and shouting and all that. And I know some of the older adults are just going to have an incredible time. And there yet isn't easy available technology like that, even though there's the most sophisticated things that are going to let me stream my Netflix and take videos and move things with my hands. And then this sort of little simple thing just hasn't yet been optimized. Cognitive care, and then tools for caregivers, right, that can maybe help them function more effectively. Home care providers. Oh, companionship and communication. Let's say a word more about this. So loneliness. I know you have thoughts on this. We have a huge loneliness epidemic in America. We see even youth talking about how lonely they are and how they have a hard time connecting. Thoughts on what an increasing challenge loneliness will be for this generation?
I imagine that it will continue to increase at the moment because, as I mentioned before, more and more folks are working to care for their relatives, their parents, the adults in their life, the elders in their life at a distance. And as much as we would love for technology to play a role in those connections, they can't really replace human connection, human touch, etc. Another challenge, speaking in a broader picture as well, is the US has lost a lot of what is called in social sciences third places, access to things like parks. And if an elder cannot drive or cannot move autonomously throughout a city, then that presents challenges getting to the places where they could address those loneliness issues. I've published a couple of papers on loneliness amongst all age groups, especially as it relates to social anxiety, which can be an issue as well. So I think here we go back to your point of while we can be really optimistic about a lot of this technology, the solution will remain we need human centered approaches and human centered design that increases our connectivity to each other, not necessarily replaces it with the technologies themselves.
Yeah, I have some small hope. My local gym now has a whole range of activities aimed at seniors, and and some of this is now covered by their health insurance plans. And there was a time where gyms really didn't want to market to that audience. They wanted the young and fit, and they wanted to look like nightclubs and that sort of thing. And the idea that you would have a sort of senior class of silverhead people and bald guys, puttering around, wasn't the vibe. Well, when the economics are there, they figure out a way to make the vibe, and some of them have, and especially when they can draw people in during the time that the gym is not very crowded in the middle of the day, where seniors might have more flexibility and they've got a bit of a coffee kosh afterwards. And I'm loving that. I also heard that Barnes and Nobles, which was like as good as dead a couple of years ago, is back. And why is it back? It's back because they've moved a bit away from this like one size fits all megastore sort of thing to letting the local venues do more to personalize and provide that third space and have sort of a staff connection and staff recommendations and so forth. And so hopefully, I think there was some thought that the malls were going to be like the third place, and obviously the soulless nature of that hasn't quite worked out. Although I think a mall near me has like a walking group for seniors when it's cold, and they can do their spin around there. But even getting connected to that and learning about those opportunities, right, sometimes requires some sort of communication to connect people in. In Japan and some other countries, um, older people live with the younger people and help provide childcare and cooking and support, and get a lot of social value out of really having close and tight relationships with the next generation, with the grandchildren. And that's not the norm anymore for lots of countries and lots of the US. So it just sort of creates a bit more of an extreme. One other category on here is called legacy, and one of our friends, Jen Luther at Grammarly, noted, some of the issues and concerns about privacy after death, like what happens to your email account and what happens to all your digital documents. On one hand, access to stuff from whoever you're leaving your, stuff to. They may need access to stuff. On the other hand, there's obviously a big intrusion. And, how many of us, I don't know, have you done this? I've set my Gmail so that if I don't reply to any email, I think in 15 months, you get a message saying, Jules is gone. Sorry. And, hope, hail and be well, and sort of instructions for what happens to that account. And so, Facebook and Google have had to do this. But lots of people haven't really thought about it. And obviously there's a wide range of other areas where, having your digital will or how to think through these things is critical.
Absolutely. And I'd love to give a shout out real quick to our colleague Jim Siegel, who's sort of subtly been researching this for a while. He's really smart on it. And also to one of my former colleagues, Nicole Eichmann Kawara at the University of Colorado Boulder, who's done a lot of investigation into this. And during COVID, we were talking consistently about this, she and I, and how this is such an important part of our digital dignity is what happens, what do we know will happen to us after we pass? And that's part of trust and reassurance as well. And if we can't count on people to look after us after we're gone, too, how does that make us feel about where we are when we get older?
I was talking to AI startup who is trying to access data needed to predict who is likely to fall, right? We know that falling, when you're at a certain age, is this incredibly devastating thing. People break a hip, they get in the hospital, they die. It is just not the kind of thing you recover from as easily. And can we predict who is at risk? And if we can, then okay, well, we will pay to carpet your house with insurance, or we will pay for a device, or go do some intervention. Hey, this is someone who, because of whatever factors, is likely to fall, where they live, the particular physical challenges. So, like, what we need help with physical therapy. Like, what is it? And the data that they need can be locked up in HIPAA locked up things, and so maybe they can do deals with those sort of folks and help run some sort of algorithms, for those clients. There might be data that is not HIPAA covered, and God knows, what restrictions there are or aren't, or what kind of harm could be done if it's not handled properly. And so I think these are some of the issues that we are going to try to get our arms around. So again, we haven't fully scoped out the plan, but do you want to share maybe some thoughts of a couple of things? Because one thing I think that's unique and different, and it's great that we've got you in particular with sort of broader than just general privacy chops, like some of me and some of the other staff, but real experience with research and with the economic decisions that are involved here as well, because some of these things might cost, or might cost in terms of data, and how to understand what impact paying with data, or concerns about surveillance might have on adoption are the things we probably need to learn. So do you want to share a couple of the things that we're looking at doing in our upcoming work plan?
Absolutely. So going forward, we're going to do a little bit of bucketing similar that you've just gone over in looking at different types of technologies that are based on either the end user being the senior and looking at autonomy and building independence, or a caregiver as the end user and helping support an elder in their caregiving, as well as looking at how we're going to go forward with things like consent between those two entities. And then we're also going to be looking at what existing lessons we can learn from the global community. As we mentioned before, and you discussed quite eruditely, there's not always a lot of apples to apples comparison that can be done based on cultural and political and social differences. Nonetheless, there are lessons we can learn, even if it is that we need to realign some of our healthcare approaches with things that will help those technologies exist even better and be even more beneficial to outcomes here. We're also going to be looking at extending our work and sort of a fast track of the evidence building to the policy recommendation space. Often we wait many years for the appropriate evidence base to make policy recommendations, but what's going to be really cool about our work program is that we're going to kind of fast track that and build a direct bridge using my research as well as my colleagues, Jim, who I mentioned before, and Shay Swager, as well as all of the great and brilliant policy folks at FPF, to create that evidence and take it straight into practical policy recommendations for stakeholders throughout this ecosystem, and hopefully result in a lot more interesting, innovative, and supported technologies for elders and caregivers.
I'm excited about this because of how it really syncs with a range of the areas where we have teams and expertise. There's a lot of global learning. There's obviously a big U.S. focused part of this, but again, these are issues affecting a number of regions around the world, and also hopefully countries. And if any of our global listeners have interesting pointers, obviously, Japan and Korea and Italy are notable. But if there are sub areas where thoughtful things have been done around law and policy to kind of reflect the right ways to deal with tech in this environment. We want to know. But part of this is also going to be about access to data. And it's great that Jim and Shay and some of our other team who work on privacy enhancing technologies like that AI startup, do they really need all the data? Or is there a way their algorithm can run on data sets in a privacy protective way to get the learning and the analysis that we need without in a way that minimizes the privacy risk. Jim, I thought quite nicely the other day, said pets are not cats. And sorry to you cat lovers out there, but what we meant that is that they're not compliance avoidant technologies, right? They are risk mitigation. They're not, hey, I don't want to follow the rules because I did some pets. These are ways that I perhaps minimize risk, maybe work to better comply with law and preserve utility of data. So super excited about those. Anything else we missed that we ought to mention?
I think we've covered a lot. Big shout out to our partner at University of Arizona for some of this work, who really informed me on a lot of the economics pieces, Dr. Laura Brandmarte. It's been really great to talk to her, and I'm looking forward to exploring some of the unanswered questions in this work around where we intersect. You mentioned, paying through data, paying by data, and how adoption may be impacted by various privacy practices, but also looking at the broader impacts of privacy. So for caregivers, I mentioned before, working at distance, monitoring consent, there's so many impacts this could have. And I think actually having dove into this space a little bit more, it's not so much going to be having enough to talk about as choosing what to talk about first.
One final example that I'll mention, I was listening to an Uber commercial recently about safe rides for teens. And, I was like, great, I'm glad they have that. As a parent who travels a lot and wasn't always around to do all of the driving, and has a spouse that works out of the house and all that. And so there were plenty of times where my teens were taking Uber because otherwise they weren't getting to soccer practice or whatever it is. And it's great that there are programs now designed to help support that as a safe experience. But I also remember how hard it was for seniors who maybe really need an Uber because they can't drive anymore, but didn't know how to manage a cell phone or how to manage the app. And Uber created some ways that a senior could call or otherwise access. One company I see here is called Silver Ride. There's GoGo, there's Onward, there's a whole range of transportation answers. I don't know how self-driving cars are going to play a role here or not, but there's clearly some value to more driver assistance, right? Who maybe keeping us driving longer and safer if we can lean a little bit more on some of the technology when it is needed. Okay, we talked about a lot, and we always try to keep this short and sweet. Stay tuned, news coming. If it's something you are interested in supporting and being part of, if this is relevant to your company or your research, please ping us. We're looking to start by a good literature review, learn from what's already out there, and then see where there are bridges between the research, the companies, the startups, the technology development, and obviously the law and policy. So Jordan, thanks for joining. Thanks to the FPF Comms team, as always, for helping make these things happen. And happy Friday, all.
Thanks.